I am Dr. Sridevi KN. I am a consultant surgical gastroenterologist working in Bangalore in Chirag Global Hospital. Hemorrhoids or piles, as they are commonly known in vernacular language, this is nothing but a part of our normal lining. Okay, so hemorrhoids are cushions, they are vascular cushions which are present in the anal canal commonly in three positions at 3, 7 and 11 o'clock. So what they do is they act as cushions for the lining, and as the stools pass through the lining, they flatten. So they look like speed bumps when you look at them. When the stools passes, they become flat and they provide room for the stools to pass and make sure that the lining is not injured. So when do they cause problems, or when do we say that hemorrhoids is a disease? So hemorrhoids becomes a problem when they become swollen. So as they are made up of nothing but vascular cushions, when it gets congested, they can get swollen up and they can cause either pain, swelling or bleeding. So why does this happen? What are the causes for hemorrhoids? So hemorrhoids can occur whenever there is a lot of straining in that area or whenever there is a lot of pressure applied in that area. For example, if somebody is straining a lot to pass motions, it does not happen after one day, but if somebody is applying a lot of pressure, is straining a lot to pass stools every single day, they are prone to develop congested or swollen hemorrhoids. Another reason is female patients who are pregnant. So when you are pregnant, there will be increased pressure in the pelvis, and that can lead to congestion and formation of hemorrhoids during pregnancy. Again, during delivery, patients who undergo a normal delivery especially, they are expected to apply a lot of pressure during the process of labor. So that again can cause increased pressure in the area and formation of hemorrhoids. Similarly, in other patients who use a lot of weight training, patients who exercise a lot with heavy weights, especially when you do deadlifts or when you are doing squats with very heavy weights. So these patients will also notice that there is a lot of pressure in the anal area, which can lead to formation of hemorrhoids. In the elderly patients who have a lot of cough, patients who have asthma, who have had some sort of breathing problem for a very long time, or they have to cough a lot, strain a lot. So these patients can develop pressure in the area leading to hemorrhoids. Elderly male patients who have trouble passing urine. So as we know, male patients with age, they develop some increase in the size of their prostates, which will not allow them to pass urine normally, and they'll have to apply a lot of pressure. So that pressure is not only transmitted to the prostate but also to the rectum and the anal canal. So they can also have development of hemorrhoids. So these are the various causes by which, so if I have to underline one thing, the only thing is straining. So anything which leads to increased pressure in that area can cause hemorrhoids. So how do I know I have hemorrhoids? So what are the symptoms that one person can have if they have hemorrhoids? So hemorrhoids can be absolutely with no symptoms. Patients may experience a mild discomfort or itching when they pass stools, or they may have some more noticeable symptoms. The most common one, of course, is they may have painless bleeding. They may notice that after passing stools, they may have observed a few drops of blood when they clean themselves, or it may be a lot of blood, a splash in the pan, a whole jet of bright red blood which they notice either that passes with the stools or after they have passed stools. Some patients may notice a very painful swelling in the anal canal, or some other patients may notice a sharp pain while passing stools. Okay, so this may be not only because of hemorrhoids or a thrombosed hemorrhoids, but also most patients with hemorrhoids may have one or two concealed fissures or cuts in the anal area, which may be the cause of these symptoms. So when should you worry? When do you need to go to the doctor if you have hemorrhoids? So if you are somebody who is experiencing any of these symptoms that I have just mentioned, if you have pain, swelling or bleeding, or anything that causes you a lot of discomfort that is not allowing you to carry out your bowel movements normally, then you should definitely visit a doctor to confirm whether or not you have hemorrhoids and whether it is the cause of your problem. Once you know you have hemorrhoids, then we can suggest what sort of treatment is required for you. So what all are the treatment options? Now before I talk about the treatment, let me tell you what can be done to prevent hemorrhoids. The main thing you need to know when it comes to preventing hemorrhoids is that you have to completely avoid straining. There are some general rules which you have to follow, such as you have to drink adequate water, you have to take high fiber diet, you have to consume a good quantity of raw fruits, vegetables and green leafy vegetables. But apart from that, you have to make sure you get some sort of exercise in your daily routine. You have to avoid a sedentary lifestyle. Make sure that you get at least a 30-minute of walk or any physical activity during the day. And if you are somebody who has to work in a sitting job, if you are at a desk job where you are seated for 8 to 9 hours in front of a system or in front of your laptop, then make sure you take frequent breaks and you keep yourself hydrated. So if you have already developed hemorrhoids and that requires treatment, what can you do? So depending on how bad the hemorrhoids is, whether you have grade 1 hemorrhoids, whether you have grade 4, whether you have just internal hemorrhoids or whether you have some external hemorrhoids as well. So once your surgeon has examined you and confirmed your diagnosis and decided what sort of grade of hemorrhoids you have, then they will suggest to you what sort of treatment will be applicable to you. So the treatment options that are available for hemorrhoids is one, that there is no treatment and you just need to make some lifestyle and dietary changes. So make sure you don't have a sedentary lifestyle, make sure you're hydrated, make sure you take adequate fiber. So these three things along with good bowel habits where you completely avoid straining. So if you follow these things, then no further treatment may be required for your hemorrhoids. If you do require treatment, then there are two methods of treatment. Either you may need medical treatment or you may need surgery treatment. There are several medical and surgical options available at present for the treatment of hemorrhoids to make sure that you don't have to suffer with this problem. Some of the symptoms that we have seen or can be seen with hemorrhoids are, yes, they can be painful and they can cause itching. But unless you are checked by a surgeon, you need to make sure that it is due to a hemorrhoid and not due to any other cause. And hemorrhoids can go away on their own. But as I said, you have to follow lifestyle modifications. So if you are somebody who does not have a lot of distressing symptoms with hemorrhoids, and it is a very small first or second grade internal hemorrhoids or external hemorrhoids, then yes, it can be done away with just some changes in your lifestyle habit and some exercise. Absolutely. As they say, sitting is the new smoking. So if you are somebody who is at a desk job or who has a sedentary lifestyle where you're spending more than 8 to 9 hours in a seated position, that can definitely increase your chances of getting problems such as hemorrhoids. Constipation is a very vague term, but straining, if you are somebody who strains to pass stools, we all like to believe that hemorrhoids is very simple and that it is caused because of bad food habits. But it isn't, unfortunately. It is not just your food, but it is a combination of all your lifestyle factors. So it is your food, your lifestyle, whether you have any exercise, your water intake, and also your bowel habits. Bowel habits means whether or not you pass stools comfortably, whether you are applying unnecessary pressure to pass stools. So it isn't just the food that can cause hemorrhoids, but it is a combination of all these factors that lead to the formation of hemorrhoids. That is why when we treat hemorrhoids, we cannot just operate and say, okay, we're done with the treatment, you can go. So it requires you to maintain a good balance of all these factors. You need to have not only a good diet, but you need to have good toilet habits, you need to have good water intake, and you need to have some form of exercise. So you have to take care of your body as a whole and not just as a hemorrhoid.